welcome to the first video behind the graph. My name is Shane and I'm an epidemiologist with the Teton County Health Department. We know that throughout COVID, there have been lots of stats and graphs and terms that have been thrown around to try to describe the situation, and that can make it difficult to make sense of what it all means. In the coming weeks, we'll be creating more of these videos to help provide clarity on these issues and what they mean for Teton County. In today's first video, we'll be covering some of the different metrics that we use to assess the local risk level here in Teton County. And to get to the metrics page on the Health Department website, you can click on the link in the description. These metrics are an important way of gauging the risk that COVID poses to both people in Teton County, as well as our ability to respond to the situation. They assess things like the current caseload, testing availability, and how the hospital is being affected.
Okay, so my name is McKinley. Thank you for watching today. I'm with the Teton County Health Department. I'm one of our COVID public health advisors, and I'll just be walking us through today's episode with Shane. And we're just going to jump right into it and look at our first question. So Shane, how do we move into a new color or risk level?
So there are 9 individual metrics, and each of them are placed on a scale from improved to critical. They can be in one of 4 different categories. Taken together, these metrics determine the overall risk level that the county's in, and that risk level is represented by a specific color on this dial here. Simply put, if enough of the metrics improve, the overall risk level decreases, and if enough of them get worse, the overall risk level increases.
Okay, interesting. And how often are all of these different metrics assessed?
So we monitor each of them every day, but we do the full calculation and reassess the current risk level once a week.
Okay, cool. All right, so moving on to our next question. How heavily are the different metrics weighted and why?
Different metrics are weighted differently, and therefore have greater or lesser impact on the overall risk level. For example, the number of new cases is obviously a really important metric and therefore weighted really heavily. It's a really central measure of how we're doing in dealing with the epidemic.
Mm-hmm.
In contrast, metrics like community spread, while still important, are more secondary and therefore weighted slightly less. The overall weighting system really places a lot of emphasis on the new cases as well as recent hospitalizations.
Okay, gotcha. And then do you mind explaining personal risk versus response capacity?
Yeah, so this is an area that I think causes some confusion about our risk system.
Mm-hmm.
I touched on this earlier, but it is worth emphasizing. Essentially, the overall risk level relies on 2 things, both the risk that COVID poses to individuals in our county, as well as our county's ability to respond to the current situation. The day before filming this video, Teton County moved from the orange risk level, or moderate, to the yellow risk level, which is the second lowest. This is the first time that this has happened since our metric system was developed. But really, it doesn't, just because we've done that, it doesn't mean that it's now suddenly safe to go out and party with your entire neighborhood.
Exactly.
Some of that improvement has obviously been due to the recent decline in cases, but another portion of it has certainly been due to increased capacity to respond to the situation as it currently stands. Over time, the case investigation and contact teams at the County Health Department have grown substantially. Testing availability has been made much more widely available than it was at the beginning of the pandemic.
Right.
So all these things mean that we are in a better position to deal with our current caseload, but it doesn't mean that necessarily that it's safe to resume all activities as normal.
Totally. Yeah.
Obviously, we've been dealing with this pandemic for a really long time, and everyone is quite sick of it.
Yeah.
But unfortunately, there is still a lot of virus out there. So we really are urging everyone to keep being careful and taking all the precautions they need to protect themselves and their community.
Yeah, especially with the new variants floating around and giving rise to easier transmission. It's super important to keep practicing and doubling down on our personal protective behaviors.
Absolutely. And that, incidentally, is probably a topic we'll be covering in one of our later videos.
Yes. All right. And so, Shane, do you have anything else on metrics that you would like to bring up?
I think that about covers it. If you guys have any questions or any topics you'd like covered in future videos, feel free to leave us a comment on our Instagram or Facebook page, and our next video will be out March 5th.
Yeah, we'll see everyone then. Thanks, Shane.
Thank you.